Hi everyone, you're watching White Mountains TV. I'm Chris Prue and I am joined by Beth Dyson of the White Mountain Community Health Center, and we're here to talk about open enrollment in the Affordable Care Act program. Beth, thank you so much for joining us today.
Thanks, Chris. Great to be here, even though it's through Zoom.
Yeah, it is unfortunate that it's through Zoom, but I'm grateful we're able to do it this way, as I'm sure you are, because the Affordable Care Act open enrollment is coming up. So let's talk a little bit about that. What is, for those who may be looking to enroll for the first time, tell us a little bit about what the Affordable Care Act is, what are the eligibility requirements, and how does someone go about enrolling in it?
Great. So open enrollment for the Affordable Care Act, or Obamacare, is November 1st to December 15th. This is not Medicare. I often get a lot of calls for people from Medicare, and so that's a separate enrollment that kind of overlaps. So I can help people with the marketplace. So typically people get insurance either through their work, or if they're income eligible for Medicaid, the third way is to purchase it by themselves on the marketplace. Generally, people can get some assistance lowering their premiums every month through what's called a tax credit. That means that your income is below 400% of the poverty level. So like for a family of two, you could make up to like around $60,000 and still get a tax credit. Let's see, what else is good to know? People can get they can get their insurance for themselves or for somebody else in their family. If they don't qualify for Medicaid, they can, so let's say somebody was on Medicaid and got bumped off, they can apply and get some assistance that way. The program providers this year are Anthem, Blue Cross Blue Shield, and Ambetter.
Okay.
Those are the two companies we have. Yep.
And what's happening now is open enrollment, and this is only for a limited time. So what makes this a special time, an important time to sign up for your health care?
Right. So only between November 1st and December 15th can people sign up for health care if they don't have it. If you already have a program through your work or something and you just don't like the plan, sadly, you wouldn't get any tax credits to help lower the premiums, so it probably would be to your advantage just to stick on your employer's plan. But if you don't have any insurance right now, or if you've lost your insurance in the last 60 days, you can come in and sign up during a considering special enrollment. Or let's say you know that you're going to be leaving your job in February, which is only a couple of months away. You can apply, and that gives you a special enrollment period. The plans kick in December. And there's 3 different metal plans: bronze, silver, and gold. The bronze are going to be the cheapest plans, but have more out-of-pocket costs. And then silver is kind of like a middle-of-the-road plan, and the gold are the most expensive plans.
All right. Well, it sounds like there are a lot of details here, and sometimes it can be confusing, and it helps to have someone walk you through the process and answer questions, and that's where Beth Dyson of the White Mountain Community Health Center comes in. So how should people get in touch with you? Tell me about the services that you're offering to help people get signed up for the Affordable Care Act programs.
Yeah, great, Chris. So I'm going to be available Monday through Fridays. In the past, I've been able to do open events like at libraries. This year, that because of COVID, we're not going to be able to have any walk-in events. But if you need to really see me in person, I will be meeting with people Mondays, Wednesdays, and Fridays. However, my typical appointment last year was 45 minutes to an hour, and I'm limited to 20 minutes. So it's really important that people come all ready to kind of either look at plans or to put in an application. We probably can't do both within 20 minutes. So trying to prioritize, knowing what their income level is, knowing what their prescriptions are, their providers, so we can make sure they're in network. Or on Tuesdays and Thursdays, I actually can do it through Zoom. So if you have a smartphone, you can call the front office, 447-8900, and say, hey, I can do a virtual appointment, which means I can spend a longer amount of time. I can spend an hour with you. And you just give the front office your name, and they'll pick a time for you and you give them their email address, and I'll send you a Zoom invite the day before, and we can do like you and I are doing. Although I can share my screen and you can share your screen, and we'll be able to go through the process hand in hand. So there's free assistance. It doesn't cost anything. This is just something that the community center offers folks in the Valley.
That's fantastic. And because you're tight on time, is there anything people should prepare ahead of time? What would help make the process more efficient?
So if you're coming for an in-person appointment, you need to have your login information for healthcare.gov. And if you don't have an account, if you can create that account ahead of time, and typically it's an email address and a password. So we really, it's not going to be helpful to have to call the marketplace to get another login. So if people can have their login information, their 2021 income, total household income for the year, and then their doctors and their prescriptions. That's going to be really helpful.
All right, Beth Dyson, White Mountain Community Health Center. Anything else you want to say before we say goodbye?
Just I'm looking forward to serving as many people as I possibly can, even within COVID. And I hope people will, take the leap and try to do a Zoom appointment. I really am pretty good about helping people, click here, click there. So don't be afraid of it. If you've got a smartphone, I know the challenge up here is the internet is kind of sketchy sometimes, and that can be a big challenge, but try it. And if we can't do it that way, then we can always get you in for a one-on-one.
All right. And we are grateful to you, Beth, for all that you and the White Mountain Community Health Care do to help keep our community healthy. So thank you very much.
Thanks a lot, Chris.
We will talk to you soon. Everybody sign up, Affordable Care Act, White Mountain Community Healthcare, and whitemountainhealth.org, I believe is the website, right? For more information on anything you guys do?
Yep. That's
all right.
Thanks so much,
very
Chris.
much. You're watching White Mountains TV.